Till now, you must have heard about that autoimmune diseases are incurable or genetic diseases are incurable. Today, you are going to learn something different about these autoimmune diseases as well as the genetic diseases. Now, I'm going to talk about these diseases from the perspective of myositis. Now, when we talk of myositis, so myositis is an autoimmune disease where our own immune system starts attacking the muscle, resulting in chronic inflammation, and this chronic inflammation continues for long, maybe typically lifelong. There are different varieties of myositis, but the most important thing in myositis is the inflammation of muscles, and ligaments and tendons are involved later. The most dangerous sign for myositis is involvement of respiratory muscles, and once respiratory and chest muscles are getting involved, these muscles actually lose their stamina and respiratory difficulties may start. Now again, coming back to myositis, how does it happen? Why it is happening in a particular individual? So let us understand autoimmune disease in a better way. So autoimmune disease are diseases where our own immune system is attacking our own part of body or organs or tissues or cells. Now why do they attack? Ideally, immune systems are made to attack our enemies, to protect us. Now when we talk about attacking enemies, it can be bacteria, it can be viruses, it can be any other foreign body. But some process happens, some abnormal process happens, and our immune system started confusing our normal body tissues and parts to the enemy, and they start attacking. Now in case of myositis, it is muscles which are attacked, and when muscles are attacked, they become bulky, weak, and inflamed. So they are swollen, they are painful, and the functioning, the difficulty of walking, or difficulty in climbing the stairs, or difficulty in lifting the things, these are the initial signs. It is very painful at some stages. When the initial inflammation is there, it is very painful. When it becomes chronic, the pain becomes slightly less, but the functionality, the stamina gets reduced. Now coming to the basic treatment aspect of it. When you think about autoimmune disease, we think first about taking the painkillers and the steroids. See, steroids are actually going to just reduce the or suppress the immunity. Now the logic behind suppressing immunity is that doctors say that this is an abnormal immunity which is harming us. So suppressing this abnormal immunity is necessary. I do agree that temporarily it is necessary, but in long term it never helps. It has never helped anybody in myositis. So in myositis cases, if we just give steroids, it can actually reduce the pain and maybe sometimes improve the symptoms. But again, for long term, it is going to do more harm because steroids are dangerous. Steroids can attack kidneys, and steroids can attack heart, and steroids can spoil the whole of the immune system so that you get all the infections. Then for the pain, the painkillers will be given, and painkiller again will do the same thing, temporary relief, but in long term you see blood pressure happening, maybe heart disease happening, or maybe kidneys are failing. So this mainstay of treatment, painkillers and steroids, are actually not going to work. Then what to do? This is the golden question. What to do for a permanent result or long-term result? Let us go back to roots. Yes, I am talking to roots because for any disease to happen, there has to have some cause. If for any disease to happen, there has to have some cause. Means for myositis to happen, there has to have some cause. Now this is a autoimmune disease. Then this is a genetically determined disease. So there has to be something which has actually influenced this genetics and this immunity. Now what are the things which influences immunity? Let me give you the examples of an interesting kind of a science. This science is called as Psycho-Neuro-Immunology. Now when you talk of Psycho-Neuro-Immunology, it says that psycho means mind is actually influencing neuro means brain, which is influencing immunology. So see, psychology can influence the brain and immunology. So when this autoimmunity is happening, we must always consider in mind that this autoimmunity can happen because of some mental issues, mental triggers, psychological issues, past hurts, mental traumas, deep hurts, or some kind of mental shocks. Yes, these kind of things actually can put your immunity to the toss. And then this psycho-neuro-immunology also tells you If psychology or mind can create autoimmunity, then the psychology or mind can also reverse this autoimmunity to normal. Yes, there are psycho-neuro-immunological therapies which can be done. Then another science I want you to focus on is psychogenomics. It says mind influencing the genes, nutrigenomics. It says the diet influencing the genes. Then there is something called as neurogenomics, which says again the neuro or neural pattern influencing the genomics and genes. And there are social genomics where social factors are also influencing the genes. Now see, there are so many factors influencing the genes. That means there can be so many factors which are the root cause for this problem. Now I will take you to some other causes as well. I have taken this mind and stress issues one. Second most important can be the side effect of some medicines, side effects of some previously taken medicines. Yes, these side effects of some previously taken medicines can actually put an aberration or abnormality in your genes and cause autoimmunity. For example, antibiotics, which are actually killing the bacteria, including the gut bacteria, they can cause autoimmunity. But nobody focus on these root causes. But it is time to focus on them. So, if antibiotics can kill the gut bacteria and cause autoimmunity, is there a treatment which can actually neutralize these effects, create more healthy gut bacteria, and actually reverse this autoimmunity to the normal immunity? And the answer is yes. But let me finish some more factors, more important factors, which can actually put your immunity into autoimmunity. The most important factor, one most important factor is vaccination. Recently, you have seen after COVID vaccination, a lot of people have suffered from so many diseases. The most famous being the cardiomyopathies, the heart disease. And some patient also said, we got cancer immediately after vaccination. So can this happen? Definitely this can happen, because vaccination itself a lot of side effects, a lot of unstudied side effects are also there. One of them is this vaccination actually pulls your whole immunity for protection against one virus. What about other viruses? What about other abnormalities? What about other the dangerous factors or the inimical factors? How can we handle other inimical factors, other enemies? So this puts your immunity to the stress and cause autoimmunity. So vaccination can be one more important cause. There are again some micro causes, but my point here is not discussing about each and every cause here to make just video lengthy, but my focus is don't focus on myositis, don't focus on muscle pain, don't focus on just relief, focus on the root causes. And once you focus on the root causes and once you start this treatment, it can actually help reverse your disease. Just imagine somebody is having psycho-neuro-immunology abnormality. Means something happened in life which has influenced in brain, which has influenced immunology, and now it is no abnormal immunity. Why not we can do some kind of therapies, psycho-neuro-immunology therapies, which can actually reverse this? There is a possibility. We are doing it since 27 years now and the results are incredible. I am going to tell you something more interesting. There are some medicines which can actually influence genes. Previously I told that they influence negatively. Now I am telling there are medicines which can influence positively. Why not use this genetically targeted medicine and immunologically targeted medicines to actually recover this problem, actually reverse this problem and get normal immunity? Then can this genetic impacts be reversed? Yes, genetic impacts can be reversed, and there is a science called as epigenetics. Now this epigenetics is a very interesting science. This epigenetics says that you can actually change the genetic expression without even touching the genes, without even changing the genes. You need not do gene editing to change this. You just have to change the genetic expression by doing some epigenetic therapies, epigenetic activities, and some epigenetic medicines as well. Yes, I am Dr. Ravi, genetic health expert, and we have developed these tools called epigenetic therapies and tools where we use genetically targeted medicine plus all the epigenetic therapies plus all the psycho-neuro-immunology therapies we use to treat the genetic and autoimmune diseases. So whenever you see somebody having genetic problems, somebody having autoimmune problems, just pass this video, just share this video to him so that he doesn't only take care of symptoms superficially, the pain superficially, or he doesn't take care only of medicines just superficially. There is a treatment way beyond superficial relief, and this treatment goes deep down to the roots. Yes, whatever the roots are, we will find it for you. We do root cause analysis, and once we do root cause analysis, let us find treatment for that. And the good news is that there is a treatment, there is a root cause treatment, there is a genetic and epigenetic treatment. All this to summarize all this means there is a definite hope. Let's share and let's spread this hope to whosoever is suffering from the genetic and autoimmune diseases. If you have any question about this genetic and autoimmune diseases, please just write in the comments and we will try to answer there only, or we will create a special video for you. It may be another disease or it may be any other questions. So if we can help you in any other way, please let us know in the comments and share this video to as many needy people as possible.